Hi, my name is Dr. Ross Hauser. I'm the Medical Director of Caring Medical and Rehabilitation Services here in Oak Park. You're actually in one of the exam rooms. Today we're just going to talk about, what are some things to look for, in the hip. This is a young athlete who has some various aches and pains. What are some common things that we see here at Caring Medical and that can be helped by prolotherapy? It's very common for people to have buttock pain. You would be shocked, like the people get our website the most, or one of the things that we see the most people searching is buttock pain. In buttock pain, normally it's right here. There's a big bone right here which is called the ischial tuberosity. So somebody who has pain on the ischial tuberosity, most commonly it's going to be because of an injury to the origin of the hamstring muscle. So in other words, where muscles and tendons attach to the bone, those are called entheses. So technically this is an enthesopathy, which just means that it's an injury where the ligament, muscle, tendon attaches to the bone. It's weak there. It might be a little bit torn. Sometimes when people get MRIs here, it'll show that it's degenerated. But even if the MRI is normal, just realize an MRI cannot show whether something's strong or weak. All it means is that the density of the tissue is fine. I mean, it doesn't mean that it's not a bad injury or whatever. It just means that the MRI is not sensitive enough to show that there's weakness here. Because an athlete, especially an athlete who runs and who cuts and who runs up and down hills, the tissue's got to be awfully strong. So you could have, where on MRI it appears fine, but there's a lot of weakness there. So prolotherapy injections done where these things attach to the bone, where the sacrotuberous ligament attaches, where the hamstring muscle attaches, it'll cause the proliferation of the cells there, which will cause the fibroosseous junction or entheses to get strong, and then that's going to resolve the pain. So prolotherapy for ischial tuberosity pain is excellent, or it's excellent for buttock pain. But realize there's other causes of buttock pain. The ischial tuberosity is here, the greater trochanter's here on the side. This is the sacroiliac joint is right here. And you can see the person's a little bit tender there. And then right here is like the piriformis muscle. The piriformis muscle goes across here because you'll see a lot of people will have piriformis pain. Or they'll go to a chiropractor and the chiropractor says, you've got piriformis syndrome, which is pinching this sciatic nerve, then you're getting sciatica. So if you, poke on here and it's tender, or you poke on here and it's tender, like in other words, where the piriformis muscle attaches, the entheses are tender, you're probably going to be a prolotherapy candidate. And the reason is that the piriformis muscle is going into spasm for what reason? Often the physical therapist or people that do sports medicine, they'll say, well, your piriformis is too tight. But I mean, if you stretch it, like in other words, once you stretch it, it should completely go away. So if your pain doesn't get cured, it must mean that the piriformis muscle is contracting or is too tight for a reason. There's only going to be two main reasons why it's too tight. It's either protecting the hip joint because you've got hip joint instability, or you have laxity or injury to your sacroiliac joint. So if you have injury, like in other words, if you have sciatica and you got tenderness in your piriformis muscle, but you actually have pain right here, or when you move your hip joint, you have clicking, grinding, popping, you have instability. So instability or excessive movement of your sacroiliac joint or excessive movement of your hip joint is going to cause your piriformis muscle to keep going into spasm. So the treatment isn't stretch your piriformis. The treatment is get prolotherapy to the ligaments that hold the sacroiliac joint in place and get prolotherapy to the ligaments that hold the hip joint in place. Once the hip joint or the sacroiliac joint gets stable, the muscle relaxes, the pinching of the sciatic nerve goes away, and the person feels fine. Now, having said that, the most common reason that people have posterior hip pain is honestly just degenerative arthritis of the hip. Degenerative arthritis of the hip can cause front hip pain, but usually it causes like a dull hip pain in the back. So people who have, limitation of motion, that's the most common symptom that you have or sign that you have in addition to the pain. So somebody who getting up out of a chair is very, very stiff, they feel like they can't move their hip joint normally, and then they have these dull kinds of pains, they probably have hip arthritis. The diagnosis generally is made by x-ray. Obviously, I'm not the biggest fan of x-rays, but with hip arthritis, it actually helps. It helps the prolotherapist to figure out what is exactly limiting the motion. Because sometimes you have to get rid of pain and you also want to improve motion. So there's basically three things that cause limitation of motion. One is going to be the most common thing that people think of, which is articular cartilage degeneration. So that the space between the two bones is narrowed. So that's one way to find that out. Two is whether or not they have bone spurs. So if somebody has bone spurs or articular cartilage that's narrow, that's going to be helpful for a prolotherapist and what kind of prolotherapy you do. And then sometimes, but they sit too long. People don't think about it. Like, they get pain. You could have a totally normal joint, and if you have pain and you just keep sitting and you keep babying it, guess what's going to happen? You're going to lose motion. So we'll get people right away on a very easy exercise, which we like cycling. First of all, cycling gets you outside. You can do it with your loved ones. Do it with the kids. I mean, cycling is just spectacular. Cycling causes excessive motion of the knee, of the ankle, of the hip. So it's probably the very best exercise for those joints, just to keep those joints lubricated. And guess what happens? When you start cycling, guess what? You get more range of motion. So prolotherapy, as I often say, is very, very good at getting rid of pain, but the person has to exercise to get more motion. Prolotherapy doesn't magically get somebody more motion. If it magically got somebody more motion, I would just say to this athlete, here, I'll do prolotherapy today, then just lay here for 4 to 6 weeks, then I'll come back. That's silly, but it's true. Like, if you just sit all day, what's going to happen if you sit all day? I mean, you're going to lose motion. You're going to lose motion. So that's why if you have a degenerative condition, you got to move. Whether it's swimming, I did go for a swim this morning, didn't go so good, but I did go for a swim. Then, or cycling. Swimming and cycling moves a lot of the joints. It's very, very good if you have limitation of motion. So as it relates to the posterior part here, typically if somebody has tenderness of the sacroiliac joint, this is the ischial tuberosity, so that's probably going to be a hamstring problem. If somebody has tenderness over the greater trochanter here on the side, there's the iliotibial band or some muscle attachments here. That responds really good to prolotherapy. And then if you have limitation of hip motion, like you can't move this hip compared to this hip, like this hip doesn't move so good, it's probably that you either are sitting too much and all the structures have contracted, so thus the treatment is moving. But if you have bone spurs, articular cartilage degeneration, then really what you should do is get prolotherapy. Prolotherapy will proliferate the cells grow the tissue gets strong, whether it's cartilage tissue, muscle tissue, tendon tissue. The joints become stable. Then the person can do more. It's like a catch-22. Once you start doing more, that even helps more, then you get rid of pain. So anyone who has chronic, hip pain, ischial tuberosity pain, piriformis syndrome, I'd really, really encourage them to get an evaluation for prolotherapy. Prolotherapy works great. If you have any questions concerning this or any other video that we've made at Caring Medical, please email me at drhauser@caringmedical.com.